Ask the Doctor with Michael Lange begins in 10 seconds.
10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So for those of you that are new to the program, who's Dr. Lange? I'm a board-certified optometric physician. I'm a certified nutritional specialist. I have degrees in psychology and physiological optics. Started hosting Ask the Doctor April of 1993. Folks, that's 31 years. Time flies when you're having fun. And I hail from the Lange Eye Institute in the Villages, Florida. So if you'd like to see me or Dr. Susan Somerton, Dr. Lori Caputi, or our whole host of other docs at the Lange Eye Institute for your eye care with a nutritional twist, certainly come by the Lange Eye Institute in the Villages, Florida. But remember, this is a live call-in show. So once again, no matter how simple or complicated your questions are, feel free to give us a call. And I said us because I have a very welcome guest in the studio with me. I'm going to introduce in just a second. I'm going to give you the toll-free number. We're back to our toll-free number. The hurricane took this toll-free number out, but we're back to the toll-free number. So write this down, 1-877-969-8600. That's 1-877-969-8600. We're broadcasting from Salem Media here in beautiful Tampa Bay. I also want to welcome 3 new radio stations that started in December in Texas. So all of you Texans, I'm going to wear a cowboy hat instead of a Christmas hat one day soon. Remember, you're next door neighbors to my old stomping grounds in New Orleans. I should say NOLA. So we got 3 new radio stations in Texas. That's Dallas, Fort Worth, and Waco. And somebody, I think, calls that DFW. Oh, well. Anyway, once again, phone lines are open. If you want to learn more about what we have to offer, the Fortify Nutrition Company is what I founded. Since I'm a certified nutritional specialist, I wanted to develop a supplement based on the latest science, evidence-based science that has full transparency. All of our supplements, we tell you exactly what's in it. You can learn more at fortify.com. That's FORTIFEYE, fortify.com. And I'm going to give you the toll-free number twice. Write this down. I think they're answering the phones this morning. It's 866-503-9746. Fortify Vitamins is 866-503-9746. And we do have 2 nutrition centers in Florida. We have the Lange Nutrition Center in Ocala, right on State Road 200, right across from the mall, the only 2-story building. And we're going to talk more about who's in that building in just a second. And we also have the Fortify Nutrition Center in Clearwater, right on McMullen Booth Road, next to Publix in the Bayside Bridge Plaza. So, and also you can get all your vitamins at Lange Eye Institute. But take advantage of all the bundles that we have now at fortify.com. We've got a lot of year-end bundle sales going on. Remember, we got 30% off until the end of the year on our new vegan super protein. Folks, it's delicious. It's in 3 flavors, has a PDCAAS score of 1, just like whey protein. And there's a massive shortage in whey protein right now. So Fortify Vegan Super Protein, 30% off. We got the Holiday Wellness Bundle, which is the Fortify Complete, the Focus, the Omega Max, and the Rejuvenate. All of that, the Holiday Wellness Bundle for $129. And then the Vegan Super Wellness Bundle for only $99. That comes with the Vegan Super Protein, Rejuvenate, and the Superfood. So remember, your best deals on fortify.com are in the bundle section. Check it out. And with that, I am going to introduce a friend, a colleague I've known for many years now. His name is Fabien Hronec, and he is, well, I guess, actually, before I start bragging about you, Fabien, I just want to introduce you. Thanks for being a guest on the program. I want you to introduce yourself to all of our listeners.
Thank you, Dr. Lange. I appreciate it. I think this is a year in the making now. I've been excited to get on this show. My name is Fabien Hronec. I'm a founder of Reboot Self Care Center, and I'm actually located in that 2-story building that you have there off of 200, right next to Fortify Vitamins. And I'm looking forward to talking about our goal for helping people with self-care, getting control of their own health, and hitting some questions and answers if we have some today.
Right. So this whole show is going to be about anti-aging and wellness. And there's one thing that I'm going to ask Fabien. We're going to see if he studied and if he's as good as I think he is. If there's only one thing that we could do for our overall health, all right, one thing to help our blood pressure, our diabetes, our psychological well-being, macular degeneration, cataracts, just one thing, all right, what would it be?
Managing your weight.
Bingo. He's right on the same page. That's what I like about Fabien. And that's one reason I was happy to have him in the same building with us, because we're like-minded people. We think on the same wavelength. You know, God made a pretty good body. As long as we give that body the right fuel and we treat it correctly, there's a whole host of things that we can do so that the body can perform at optimal levels. And like I said, Fabien is on the same wavelength with me. He's been helping people. When I met him, he was a personal trainer, and he was helping patients lose weight, build muscle, you know, boost their immune system back before he started Reboot in Ocala. And I just want to talk a little bit about that. You actually went to the Institute for Integrative Nutrition and became a certified integrative health coach, didn't you?
Yeah. So that was after I became a trainer. And I think the big influence there was that as I was helping clients, they're starting to trust me. They're asking me more questions. They would ask me questions about blood pressure and if they're taking thyroid medication and how can I help my thyroid, my adrenals. And these are subjects that they don't teach you in personal training courses. I did a lot of different training courses as a personal trainer, and even the most advanced ones don't really touch on the nutrition side in that sense. So I went to the Institute for Integrative Nutrition. It really opened my eyes into healing the body through food and using breathing techniques, emotional. They taught you that your gut is your first brain, and then your second brain is your actual brain. Because if your gut's not right, then nothing's going to be right emotionally or physically. So it was very cool to learn that from some of the professionals like David Wolf, who've been in it forever. And that launched me into focusing more on the wellness side. So that's been my main focus for the last at least 4 to 5 years, is focusing into the wellness side. And that's when you and I really linked up, I think.
Right. I remember I came to you, and you had, before you opened Reboot in Ocala, you actually had a device that analyzed hair follicles for nutritional deficiencies. Yeah. And I like to think that I eat well. I mean, I eat a diet consistent with a diet I created called the Lange Survival Diet, which is similar to a modified ketogenic paleo Mediterranean diet. I've taken all the anti-nutrients out of the diet, things like oxalates and lectins and phytic acid and gluten and FODMAPs and all of these things out, and created the Lange Survival Diet. And I'd like to think that also I'm taking the supplements that I've created under the Fortify label. And then, you know, so I'm thinking I'm as perfect as it gets. And we did that hair analysis, and, you know, we saw that really I needed some other nutrients that I wasn't aware of.
And I remember that, because when you got the report, the first question was, well, I take Fortify fish oil, but why would I have any kind of omega deficiency? And the answer is, you could possibly not be breaking down fat and absorbing it properly, right? So it's not the supplement, it's just your body may have had an issue with that specific function at that point, right?
Right.
So that's where we can eat perfectly, we can supplement perfectly, but if the body can't absorb and break down the nutrients, that's a problem on its own. So it's really nice to be able to bridge that.
Right. One thing I learned from you, and also you mirror what somebody world famous actually taught me, and that's Victoras Kovinkas. Victor Kovinkas started as one of the guys with Ann Wigwam that started the Hippocrates Institutes worldwide. He lives in Costa Rica now,
Yeah.
and he's a good friend of mine. And you had mentioned this, and it might have been on some of the stuff that we did about protein, maybe not absorbing as well. And you talked about having, taking some enzymes prior to eating the protein or prior to consuming a protein shake or eating pineapple or apple cider vinegar. I'm pretty sure that was you. To help us break down and metabolize the protein even better.
Yeah. Yep. Definitely. Because of the scanning showing me that you have low stomach acid or you may not be synthesizing protein well, I have to say, and just in my opinion, that might be one of the epidemics that come up, is not being able to break down protein well and absorb it. Because if you can't, that undigested protein irritates the small intestine, causes gas and bloating. And I see it constantly, and that leads to IBS and so on. So the digestive enzyme is a great way to help the stomach break down and absorb the protein, as well as things like Bragg's apple cider vinegar, making sure you chew your food properly, and those kind of tips. But yeah, that's a huge thing I have to teach more and more now.
Right. I like, especially after working out, oftentimes, if you take our grass-fed whey protein isolate or our super protein or even our vegan super protein, a little trick of the trade is just add some pineapple to it. Pineapple has a proteolytic enzyme called bromelain that helps to break down the proteins as well. It's also anti-inflammatory. And then you think about it, after you're working out, you want to replenish that muscle glycogen. So the fruit that definitely has some glucose properties, so it helps replenish muscle glycogen.
If you don't mind, one more tip with that I learned later in life is to never chug your protein shake. And so I had to learn that the hard way, because the way it was taught to me is if you chug your protein shake, it just flushes right through the system versus taking swigs of it. Swig after swig is fine, but if you chug it, then your body doesn't get a chance to absorb it the same way as if you take sips of it.
So we shouldn't be guzzling.
No guzzling, not protein shake.
Only guzzling on New Year's Eve. All right, I'm Dr. Michael Lange here with my health coach and health expert, Fabien. So if you've got a question, give us a call, 1-877-969-8600. That's 1-877-969-8600. We want to see if that toll-free number is really working. Joe tells me it is, but we haven't had that number working for about 2 months, or ever since the hurricanes. So at least give us a call and say, hey, yeah, we can hear you loud and clear. Phone number's working. 877-969-8600. So it's almost Christmas. So that's why I'm in my Christmas festivity outfit. And Fabian's holding up his Christmas bear. And we want to wish everybody a very Merry Christmas and certainly a Happy New Year and also a Happy Hanukkah. And a Happy Kwanzaa for those of you out there. I could just cover it all by saying Happy Holidays. But anyway, Merry Christmas. We may be back on the show right before the new year. I'm not 100% sure. We'll see what the family has to say. Who knows? We might be going further south to get away from the cold and go down to the Keys or something. But I very well may be next Saturday live, and then we can wish everybody a Happy New Year. All right. The phone lines for Fortify Vitamins are 866-503-9746, 866-503-9746. And that brings up how important digestion is, especially as we mature, as we age. Digestion is crucial. As we get older, oftentimes the acidic component in our gut, the natural microbiome, the gut flora isn't what it used to be. And that's where enzymes do come in play. Taking a good enzyme, and Fortify, we have one that I think is really good, Fortify enzymes. You can take that like 5 minutes before you eat any cooked food or before you take your protein shake. And then adding some probiotics, preferably on an empty stomach. And Fortify does make a good probiotic. If you're 200 pounds or less, 3 a day. If you're 200 pounds or more, you probably need to take more. If you're only 90 pounds, you probably need only 2 a day. But look at Fortify probiotics and Fortify enzymes, and we do have a digestive bundle that encompasses both of those. That could be a great gift for one of your loved ones, believe it or not. Give them the gift of health. So check those things out at fortify.com. And we're going to talk a little bit about something that is near and dear to me and what we started talking about in the show just a minute ago about weight management, okay? When I see a patient that's dramatically overweight, obese, and they can pinch a lot more than an inch, main thing I counsel them on and talk to them about is, getting down to their ideal body weight. That's the best thing they can do for their macular degeneration, their glaucoma, their diabetic retinopathy. Now, obviously, you got to do what your doctor says. You got to take your medications and you got to do everything like that. But losing weight is one of the best things that we can do. So a lot of you are looking for a shortcut, okay? And you're wanting to go to the doctor and everybody wants a magic pill. Isn't that true, Fabian? Everybody wants a magic pill, right? To lose weight.
Absolutely.
And so is there a magic pill? Well, there's a magic injection, and now they actually having a spray, and it's a GLP-1 receptor drug. And if you're under medical supervision for this, you're talking to your doctor about it, and you want to lose weight under medical supervision, and they're following you closely, more power to you. But I know a lot of you out there, believe me, a lot of you, even on my staff, that have been trading these little syringes around to lose weight. That's not the safest thing in the world. These GLP-1 receptor drugs are associated with a lot of potential negative side effects if used incorrectly, and if he's even used correctly. So there's a new one that just came out, and I've seen this in patients already. When you're taking these weight loss injectable drugs, it can increase your risk of something called ischemic optic neuropathy, and you can go blind from that. That's kind of like a stroke to your optic nerve. So anterior ischemic optic neuropathy is not something you want to get. And so think about losing weight naturally. And that is what Reboot and Fabien is an expert at doing in Ocala. And then also, we're going to take it to the next level. We're going to talk about some of you men out there that are overweight. All right, let's face it, none of us want to look overweight. We all want to be able to take our shirts off and walk down the beach and look good, right? With abs, but that's not everybody. So a lot of you men out there that are overweight and not overweight may have ED. And then you know what that is? That's erectile dysfunction. So what are you doing? You're taking the little blue pill. And I'm not going to mention the names due to legal ramifications. So now you're overweight and you have ED. It's the double whammy. So you might go to your doctor and have a GLP-1 receptor drug, and you might get a prescription for an ED medication. That's a double whammy for ischemic optic neuropathy, all right, for going blind. It's as simple as that. So once again, take heed to my warnings and, visit Reboot, visit Fabien, and find out ways, and we're going to talk about this more, natural ways to lose weight healthily and safely without increasing your risk of ischemic optic neuropathy and other things like sarcopenia, that's muscle wasting. So I'm going to give you the phone number. Write this down. This is for Reboot Self Care in Ocala. And I think this is the number, and you tell me if it's wrong, but it's 352-820-3151. Right?
Got it.
All right, write this down. That's for Fabien Hronec at Reboot Self Care. That is 352-820-3151. And if you're interested in weight management and weight loss, this is the place to go. Your New Year's resolutions. And I got to tell you, the price is not that bad. I see we got people calling, and I don't know if they're calling and just stating that the line's working or if we're losing them. But phone lines are open. Give us a call at 1-877-969-8600. That's 1-877-969-8600. So with weight loss, with weight management, we always talk about, doing specific things. Exercise, all right? Exercise is important. Proper diet, proper supplements. Believe it or not, the right amount of sleep, all right? All of these things are important. And I tell people that it's a good idea to go more on a ketogenic modified type of diet, eating more protein and vegetables and less processed foods, less complex carbohydrates that are man-made like pasta and bread, rice, even potatoes. And then at supper time, if they really want to lose weight, is just eating protein. That's kind of like a carnivore diet for supper, because then they don't have any carbohydrates when they're sleeping at night in their gut. So just to survive when they're sleeping, their heart rate's beating, they're swallowing, they're breathing, they're actually burning fat because they have no carbs. And then wake up in the morning, their glycogen's gone because they didn't have anything. And if they go and walk a mile or 2 miles or an hour, some sort of mild cardio in the morning before breakfast, we can lose weight even quicker. What do you feel about that?
Yeah, so those concepts you mentioned make total sense. It's really important for the sleep because the body does a lot of detoxification through your sleep as well. And then, of course, depending on how your body processes food, protein, carbs, fat, if you're going to eat a specific amount of carbohydrates, it's good that you use that fuel, right? So the idea is if you're going to eat carbohydrates that are maybe higher starch, then try to do some kind of an exercise or make that the beginning part of your day so that you burn that energy through the day. Definitely.
Yep. And I also want to mention, I see line 1 blinking. I don't know if does that mean there's a caller on line 1? Oh, I can't see it. I'm not sure who the caller is on line 1, but we're going to go to the phones. Line 1 caller. I'm missing the name. Who is this?
Hello?
Hello. Welcome to the program.
Oh, Dr. Lange.
Yes.
I'm Jerry. I got a question for you. My neighbor has had a cornea operations and it failed and something. Is there anything you can do about that?
All right. So with a corneal operation, especially if you had a corneal transplant or something like DSEC,
Yes.
You can have rejection of the corneal tissue. Okay. And so the corneal specialist would have to look at that and see if he's getting rejection. And there's certain types of medications that we can use to help with rejection. But the corneal, he needs to go back to the doctor that did the corneal surgery. And if he doesn't like what that doctor says, then I would get a second opinion from another corneal specialist. All right.
Is there a special group you could look for? I mean, or agency that?
Yeah. Where are you located?
On this?
Where is he located?
I'm near Ocala.
Yeah, in Ocala. You know what you could do? Take my email down. All right. I just don't want to mention names over the radio. And shoot me an email, and I'll give you some really good corneal specialists that are in the area. Okay.
Oh, great.
So here, get a pen and paper, and
yes, sir. I have that, doctor.
All right, here it goes. iDude92. So EYEDUDE 92 at iCloud.com. And that's iCloud, letter I, iCloud.com.
Okay, it's IEYE, dude, D-U-B?
D-U-D-E, dude, like, hey, dude. So iDude92 at iCloud.com.
Thank you very much, doctor.
All right.
And is there anything that improves, doctor? Is there anything that improves, like you have an integrative medicine gentleman there? It improves the cornea health or something so you don't have trouble with it?
Well, I think what we talk about in this program is weight management is very important, because if we're overweight, a lot of the good nutrients that go to your eye hang out in the adipose and the fatty tissue in your body, right? So the things to promote overall wellness, believe it or not, indirectly promotes eye wellness as well. But, it doesn't replace seeing your ophthalmologist or optometrist or optometric physician, because there's certain diseases in the eye, like glaucoma, that's the sneak thief of your sight, diabetic retinopathy, where you can be totally asymptomatic and not be aware you have these problems until it's too late. So as a rule of thumb, seeing your eye doctor on an annual basis is a good idea. And to take it to the next level, I usually recommend seeing an eye doctor that has optomap capability. Optomap is where they actually do a specific scan of your retina, and it looks at everything in the eye. It also tells us about your systemic health, believe it or not. So it's always worth finding somebody that has an optomap, because they can pull it up and show it to you and go over everything in detail. Okay?
Yes. Thank you, Dr. Lange. I'll do that.
Right, have a good
Merry
one.
Christmas and a Happy New Year. Bye-bye.
You too. Bye-bye. And now the screens are working. All right, you're listening to Ask the Doctor. We're here with my very welcome guest, Fabien from Reboot in Ocala. Give us a call, 1-877-969-8600, 1-877-969-8600. And we do also practice what we preach. I know Fabian's in the gym. He's working out a lot. He's in good shape. He's very lean. So it's not like you have somebody that's 400 pounds dispensing this information to you.
Thank you, Lange.
All right, we're going back to the phones. Let's go to, I think, Kevin and Citra. Kevin, good morning. Welcome to the program.
Wow. Good morning, Dr. Lange. It's great to talk to you. I've been one of the first listeners from 30 plus years ago, and I just You've been so remarkable. I don't understand how you can keep all that information in your head without your head exploding. I mean, you have more knowledge, and you just spit it out. I've never heard anybody, explain things like you. But thank you so much for sharing. But my question is, Dr. Lange, it's not a nutrition question so much. I just had a birthday last week, Wednesday this week, and I turned 67. And I'm colorblind, which is no big deal. Red, green, they say I'm red, green, colorblind. But my wife thought I should start seeing colors, so she bought me one of those glasses. And I stepped outside and looked at my neighbor's hibiscus shrub with the red flowers, and I still could not see them. I still saw just whatever, one color, where it was green or brown or whatever it may be.
Right.
I was just wondering what you thought about maybe those glasses, but I really wasn't interested in them, but my wife thought I should have them. But I was just wondering what you thought about that.
Yeah, the glasses for color blindness don't work that well because they just make everything a different color, basically. Okay. And you're not colorblind because you can see colors. You just can't differentiate between the different hues of colors. So you wouldn't be great as a fashion coordinator, a fashion designer. But you can see the red lights and the green lights when you're driving the car, right?
Correct.
Yeah. And so the only way to really help with color, if you wanted to pass a color test, those color plates and be able to see everything on the color plate, and that's only if you're going to be in law enforcement and military. That's the only thing that comes into play, and airplane pilots. But there's a contact lens that you wear on one eye, okay? And it's called a chroma. Oh, I can't even think of the name of it now, and I've fit thousands of them. Anyway, it's a special contact lens. They make them. They used to be only in hard lenses, but now they're in soft lenses. You wear it on your non-dominant eye, and it enables you to see the different hues of colors. But like you said, you've gone 67 years with this. This is something that was hereditary. You were born with it, and it hasn't probably affected your life at all, except sometimes maybe you put some things on that don't match perfectly and you tick your wife off. But other than that, you're probably fine.
Yeah, it sounds good, Dr. Lange. Thank you. I thought the same. You give me that answer. And I am going to make an appointment specifically to come see you, have an eye exam, because I don't know if I've ever had one of those in my life. But no rush. Everything seems fine. But I would like to come and have you take a look and see what you think.
All right, I think it's time. And just I look forward to seeing you and have a Merry Christmas.
Merry Christmas to you, and God bless you. Thank you so much. Bye-bye.
Thank you. Yeah, we've had a lot of callers, a lot of listeners for many, many years. I think, baby, this is one of the reasons this talk show is why I became so successful. We opened 14 eye care centers and 3 LASIK surgery centers, in the first 10, 12 years when I started. And then I was blessed to have a company offer me a large sum of money to sell all my offices except the Lange Eye Institute. So I enjoy still seeing patients. I really enjoy helping people. And I look at the eye as the window to the body, so we can tell a lot about a person's general health through an eye exam. So an eye exam may not only be vision saving, ultimately it could be life saving. All right, we're going to open up the phone lines. I'm Dr. Michael Lange here with Fabien Hronec. Now his name is actually Hronec. So every time I look at it, I'm thinking Hronec, but the H is silent. And once again, he's trained at the Institute of Integrative Nutrition. He's a certified integrative health coach. He's also a certified trainer. And I got to tell you, he knows what he's doing for these patients to help you with anti-aging and wellness. And once again, New Year's resolutions, we all want to be healthy. We all want to live as long as we can, as long as our quality of life is there. And that's what Fabien is excellent at doing. A lot of my patients have gone to them extremely happy. Now, I got to tell you, there's a lot of places, Fabien, out there in Florida, especially and in the villages. Let me tell you, they're charging some significant money for what you guys are doing. Okay.
I've heard.
Significant. I'm talking, you could buy a Porsche. Okay. And so I've sent some people for second opinions to you that have been very happy. And, there's some things that they do at Reboot. I'm just going to mention a few and we'll talk a little bit more about them. But epigenic testing, that's epigenic follicle testing, pulse analysis scans, colon hydrotherapy, hyperbaric chamber therapy, detox dome therapy, exercise with oxygen therapy, red light and near infrared therapy, vitamin IV therapy, custom formulations based on these epigenic follicle testing. So they do some things that are out of the box, a little bit different, a little bit more holistic and natural, which we're all in tune with. And I think that is pretty amazing. And so you probably are starting to get people come from a long way away,
Yeah.
because your prices are so good. I think you told me that a complete evaluation, you can tell me what it is, but it's $495. What does that entail?
So that includes, so we're using technology to scan the body, right? And there's 2 scans. One is the epigenetic hair follicle scan, and that's how we see what you're deficient in and what you have too much of in the body. That's what you and I did about 6-7 years ago. The second scan shows us physically how the body's functioning. So then it's a visual that you're seeing. So if your lung needs support, kidney, bladder, your nervous systems, you see it right there in front of you. And so then you and I go through that for over about an hour to go through it to help explain what's going on. Because that's the key, is education, just like you educate your listeners, right? So we want to educate you in that hour, what's going on, what you can do about it. And then you get a 90-day plan to follow, which includes food, supplement, and therapy recommendations. And so that's all for $495, because it's meant to be an educational session, which then everything else we offer, you decide how you want to move forward, but we lay it out for you.
Right. That's amazing. And that's a great deal, folks. If you look at some of the places in the area, they're charging significantly more than that. I mean, I've had patients that have gone in for the full money and they're paying, I mean, literally close to 6 figures. And your full money, and when I say full money, that's all the bells and whistles, is, right around, and it includes this $495, is about $5,000, right?
Yeah. Yep. And that's everything you need for 90 days.
Yep. So it's pretty amazing. And a lot of you that have had some of this technology utilized before and been paying significantly more than that. I mean, some of you, 20 times that. So it's not a bad deal. So Reboot is located on State Road 200 in Ocala. Some people call that Southwest College Road. That's 3101 Southwest College Road. That's the old Lange Eye Care building, 2-story building right across the street from the Paddock Mall. Only 2-story building on the block. You go in the elevator, go up. They have the entire left side upstairs of that medical building. And that's Reboot Self Care. And that's right across from the Fortify Nutrition Center. And like I said, I put like-minded people and healthcare providers in that center. We have neuropsychologist Patrick Watson, the Fortify Nutrition Center, Dr. Yang and Dr. Yang, Hear More Medical, Dr. John Poser, the plastic surgeon, and of course, Reboot. And who is at Reboot with you? You got a whole team, right?
Yeah, so we have a team, Dr. Thomas Bijay, which is my mentor. That's where I learned most of what I know from. And then we have colon hydrotherapists, nurses for the IV therapy. We have our front desk. But yes, there's definitely a whole team, and it takes a team to, provide what we do, because there's a lot of pieces to it.
Right. And
Yeah.
Dr. Bijay is, he's not only a traditional, medical doctor, allopathic, but he's also holistic, naturopathic, and Eastern medicine, Chinese medicine. I mean, he's done a lot of training, and globally he's well renowned.
Yeah, so the idea of combining Western, Eastern, and Ayurvedic medicine together is what we've done. So you're getting the best of all worlds, because they all have their benefits, but they all also think they're the best, right? Western medicine, Eastern medicine.
Right.
So if you can combine all three and they each tell you this is the root issue, then that's how we approach it. And we go from the root issue and work our way out to address the symptoms. And that's how we're having success.
Awesome. So we're getting ready to take a break here in just a second. But I want to mention the phone number, if you want to give us a call, is 1-877-969-8600. That's 877-969-8600. Check everything out at fortify.com. There's the music, and we'll be right back with Fabien and Reboot in just a few minutes. So stay tuned.
There's nothing more frustrating and irritating than chronic dry eye. It never stops. the itching, the scratching feeling, the fatigue and weariness.
Yeah, my
If you're
water with
suffering
my
from chronic dry eye, go to fortify.com and join thousands who've discovered Fortify Advanced Dry Eye Therapy, a combination of Fortify Super Omega, Fortify Focus, and Fortify Blackcurrant Oil GLA. Fortify Advanced Dry Eye Therapy works to address oxidation and inflammation in the eye and the entire body. This combination, once only available to patients in the doctor's office, has now become available to you. And already, countless numbers of listeners have found relief with Fortify Advanced Dry Eye Therapy. If you or someone you care about struggles with dry, itchy, exhausted eyes, order Fortify Advanced Dry Eye Therapy today at fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746 and at fortify.com.
While others are hitting happy hour, you're hitting the gym. While they're hoisting mugs, you're lifting kettlebells. You owe it to yourself to get the most out of your fitness regimen before and after your workout with Fortify Fit. Fortify Fit's power-packed formula is designed to enhance muscle synthesis, strength, and endurance. All evidence-based nutrients in this proprietary formula are well documented and backed in good clinical studies. Taken before and after your workout, Fortify Fit is also hailed for what it doesn't contain. No dyes, artificial flavors, or carrageenan. With Fortify Fit, you get all you need to get the most out of your workout without needless additives and sketchy sweeteners. Order Fortify Fit today at fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at fortify.com.
All righty, welcome back. You're listening to Ask the Doctor. I'm your host, Dr. Michael P. Lange. P for Paul. If you've got a question, give us a call, 1-877-969-8600. That's 1-877-969-8600. And if you'd like to call and make an appointment to see any of the doctors like Dr. Lori Caputi, Dr. Susan Somerton, myself, Dr. Michael Lange at the Lange Eye Institute in the Villages, I'm going to give you this phone number. It is 352-753-4014. That's 352-753-4014. And the Lange Eye Institute is right on County Road 101 and 466 in the heart of the Villages, just a hop, skip, and a jump from wherever you are. And we're also in the expansion mode. We're expanding to almost 6,000 square feet more at the Lange Eye Institute with 12 more examination lanes. And we're doing that because we're encompassing and getting ready for the biophotomodulation therapy. That's hard to say. It just got FDA approved a few weeks ago. And folks, this is 3 frequencies of light to help treat the dry form of macular degeneration. The one that comes to mind right now is the Valida light therapy. And it's using a series of lights, and red light is one of the frequencies, yellow light, and then another light that has different frequencies. And so that's going to be available soon. We're hopefully going to be one of the first in the area to get this type of treatment. So when you come to the Lange Eye Institute with dry macular degeneration, we go over what foods to eat, what foods to avoid. Believe it or not, you don't want to eat carrots and sweet potatoes, okay? And people are going, really? Because that's very high in beta carotene that blocks the absorption of lutein, zeaxanthin, and astaxanthin. By the same token, you don't want to be taking a vitamin that has beta carotene in it. So be very careful. If your multivitamin has beta carotene in it and you have macular degeneration, you may not want to be taking that. So the things you learn right here on Ask the Doctor. And we do have a caller. Once again, we're here with my very welcome guest, Fabien Hronec from Reboot Self Care in Ocala, Florida. I'm going to give you the phone number one more time for Reboot, and I'm going to give you their website. Reboot's phone number is 352-820-3151. That's 352-820-3151. And Fabien, what's the website they can go to?
www.rebootselfcare.com.
Awesome. Rebootselfcare.com. All right, let's go to the phones. Steve in Clearwater. Good morning. Welcome to the program, Steve.
Yeah, I don't understand that maybe that Fabien could tell me, a lot of people who are older people that are taking calcium, they're taking so much calcium that the other more minor minerals kind of get aced out because they compete for absorption. Has he found that a lot of people who take too much calcium have an abnormal hair analysis?
So with the hair analysis, we don't get to see too much of any nutrient, right? We get to see if there's a deficiency.
Oh,
But
okay.
I do agree with you. It is something that's recommended a lot. And the issue is if you can't absorb calcium properly, that can cause issues.
Mm-hmm.
And so one of the dysfunctions that we see is not breaking down certain foods like protein well, which is a big building block for the body. And as you get older, that can be a little more common because of the lifestyle. So getting your body to break down the protein and absorb it better is a way to help the body stay strong, the muscle tissue, the bone, the tendons. And so calcium isn't always the answer, but I know it gets recommended a lot because of the idea of helping keep bone strong, right?
And Steve, you bring up a valid point, because you think about it, people are just willy-nilly getting their calcium pills, from the local store, and they don't know what they're getting. They're getting calcium carbonate, and they're getting way too much. And my macular degeneration patients, we don't want them to have that specific type of calcium, because it can actually cause calcification of the arterioles and all that feed the retina. And so when you're taking calcium, you need certain things with it to help it absorb. Once again, it's all about absorption. Vitamin D is crucial. Anybody who has a 25 hydroxy vitamin D blood test, everybody should have that done. And that has to be over 60. I like it 70 and 80. But you need not only vitamin D, you need some magnesium, you need some vitamin K2. Now, if you eat dark green leafy vegetables, that's K1, but it will convert to K2. And then obviously weight-bearing exercise. And then you can add things like phosphorus and boron, iproflavone or strontium, a bone olive. There's other things out there that can help make the calcium absorb. And we think that hydroxyapatite is one of the best forms of calcium. But as long as you stay away from calcium carbonate, even calcium citrate's decent. So that's a valid point. Too many people are taking way too much calcium of the wrong type, and it's not really absorbing into the bones.
Yeah, plus when people get older, they just don't have that stomach acid to ionize it.
Yeah, so that's a great point. And so increasing stomach function, there's some simple things me and Lang were just talking about earlier. Bragg's apple cider vinegar in the morning, add it to water. Bromelain, which is a supplement you can get separately, or a digestive enzyme like the Fortify one. Those are things you can do before your meals to start improving stomach function.
Yeah. And one more question. I, for the life of me, do not understand why every emergency room in this country does not have a hyperbaric oxygen chamber for people walking with a stroke. I mean, if you have 50%, now this isn't perfect, but if you have 50% blood flow into the brain, and you go from normal air you're breathing and put on oxygen, and you can force that oxygen in, you can literally cancel out the deficit. It's simple math. And yet very few emergency rooms, when you have a stroke, do not have a hyperbaric oxygen chamber to put you. It's so simple, and it would be so effective. Why don't they do that?
That's a good question. And you guys have 2 hyperbaric chambers at Reboot, don't you?
Yeah. I think it's a time and financial thing. So how much money can you make out of a patient that is going to go into a hyperbaric chamber in that whole hour plus prep and the nurses you need? I just think it's more of a time management and cost factor, unfortunately.
And a lot of these hyperbaric treatments are not covered by insurance.
Well,
so it can get very costly.
Yeah, and it seems to me it's a hell of a lot cheaper than if you solve the stroke when you're having it, than to put a person to let the stroke continue and have 10 years of chronic long-term care. I mean, it's stupid.
Agreed.
Agreed.
I'm sorry. I just, it constantly amazes me as Donald Trump says we have a lot of very stupid people in the world, and the people that are running this summit. That's what amazes me about the medical profession. There's some of the most brilliant people in the world are in the medical profession, and then you'll find one or two at the top of the regulatory, and it just don't know what's going on.
Steve,
Anyway,
I am surprised you didn't mention the drones that are flying around.
oh well, yeah, it's interesting.
Isn't
Can
it?
you really believe they don't know what those are?
Now they know exactly what's going on, but they don't want to
They
tell
don't.
us, and maybe rightfully so. You know, I don't know. Maybe they don't want to panic us. Who knows?
Well, look, you could analyze them. You could look at the light that's coming from, what wavelength the light is coming from. You could find out what they're burning. You could look for a heat signature.
Right.
You could look for aerodynamic stability. There's all kinds of things that and parameters that you could look at to say, okay, this has to be this or this has to be that. This can't be that. And nobody's doing the analysis.
I think we're going to find out before the 20th. Mark my words. I think we're going to find out before the 20th. That's a whole show in itself.
Yeah. Okay.
All right, Steve.
And they've been over the Lange Eye Clinic.
Well, no, we have a special force field that keeps them away.
Oh, okay.
Hey, Steve.
All right.
Merry Christmas, my friend.
Okay. God bless, and thank you for your guest. She's very good.
Yep, Fabien is. He's
Thank
going to
you
be a
very
guest
much.
again very soon because we're running out of time. Thanks for the call, Steve. All right, so we're talking a little bit about just New Year's resolutions briefly, and weight loss is top of the mind. All of you can pinch more than an inch, maybe, start doing some things that we talk about in this program, maybe set up an appointment to see Fabien at Reboot in Ocala. But we all want to look better and we want to feel better. And you've heard me talk about a supplement that I'm holding up right here called Fortify Rejuvenate for almost a year now. In February, it will be a year. It's something I developed where we've taken marine collagen tripeptides, not peptides. We've taken German hyaluronic acid, rice ceramides, Dermaval, that's 9 superfoods, liposomal vitamin C, biotin, and a mild multivitamin mixture, and combined it in 3 delicious flavors and unflavored. And we made it in a larger container now than the small container. So, folks, once again, feeling better and looking better. This was developed to give the nutrition that the body needs to help with joint health, helps reduce joint pain. If you notice, I'm not limping as much anymore. My knee is feeling much better, all right? And studies have shown that the marine collagen tripeptide by itself, after 3 months, minimizes fine lines and wrinkles dramatically in the face and the arms, increases hydration, and increases elasticity. And then the studies with Dermaval, the 9 superfoods, are amazing at increasing elasticity and collagenase in the body. The rice ceramides helps reduce creepy skin and rough skin. And we all know about hyaluronic acid and joint health, and also skin health. So think about that. That'd be a great gift or a good way to start your New Year's resolutions, losing weight and looking better and feeling better. Fortify Rejuvenate. Check it out on the website at fortify.com. Now, we got a minute and a half or a minute 50 seconds left. So remember, if you are really gung-ho about really pushing forward with your New Year's resolutions and you want to make a big difference in your overall health and the way you look, consider going and seeing Fabien. I think you will find that what they offer at Reboot is absolutely amazing. And we didn't have time to go into talking about colon hydrotherapy and pulse analysis and epigenetic testing and the detox dome therapy and exercise with oxygen and IV therapy. So we're going to have you back, and we're going to talk in more detail about each of the things that you offer and how it can help everybody.
I think that the main thing we could probably leave with is what we're most known for is detox. So we have a 3-week detox program that includes a few of those things you just mentioned, and it's to reboot the body. That's where reboot came from, kind of like hitting the reboot button on your computer. So when you come in, you go through the 3 weeks, you reset your mind and your body, and then it's ready for the new year. And that's the best way we can get launched into 25, is to reset the system and then let all the good things you do, like supplements, food, exercise, actually make a good difference in the body because it's ready for it.
And that's what this show is all about, is helping you take control of your health and minimize the amounts of surgery and medication that your body needs. Like I said, God made a pretty good body. as long as it's given the right fuel and it's treated correctly. And Fabien and Reboot is here to help you. Of course, Dr. Lange and Fortify Vitamins and the Lange Eye Institute as well. Thanks for being a guest on the show.
Thank you for having me. Appreciate it. Merry Christmas to everybody out there.
All right, we're out of here. God bless you. God bless America. And Merry Christmas. Happy New Year.